We're here today with Dr. Daniel Kinney. He is a pediatrician with Beacon Medical Group, Ireland Road in South Bend. Dr. Kinney, thanks a lot for joining us today.
Thanks for having me.
Not a problem. You know, as a parent, I've been watching reports on a coronavirus-related illness in kids. So thought we'd get you on today to talk a little bit about this. What do we know about this illness right now?
This illness, known as PIMs, which is a Pediatric Inflammatory Multi-System Syndrome, is an illness that we're starting to see over the last 4 weeks, a bit more recently in the United States over the last week or two. It is an inflammatory illness, not dissimilar to things like Kawasaki's disease or toxic shock syndrome. The symptoms that we see with this include fever, persistent fever, 5 days or more. You can see abdominal pain, you can see vomiting, diarrhea, rash, as well as problems with fatigue and sometimes breathing difficulties. This is an illness that we're seeing from ages 5 to 9, and it's something that we're trying to learn more about at this point. Up to this point with coronavirus, it seems to be an illness that's not really impacting kids. And the reasons why we're trying to find out, are they less susceptible to the illness, or are the symptoms so mild that we don't detect them? So up to this point, we're watching closely for illnesses that, can be secondary to COVID. And then recently we started seeing this, inflammatory process. In most kids that are coming down with PIMS, we have no history of past, a chronic illness. We have no history of a recent illness that might be secondary to coronavirus. So they're coming in with new onset illness, and then developing worsening symptoms progressively.
Now, this isn't widespread yet it's growing in number of kids with these symptoms and with
Yep.
the syndrome nationwide, but I don't even think there's a case, at least, right now at this minute in Indiana.
No, there's not. It is still exceedingly rare.
Okay, that's
And
good to know. And what do we still need to learn, doctor, about this illness, about this syndrome?
we need to learn what could be triggering it. Is it coronavirus? Not all patients with PIMS are coronavirus positive. Some are negative. At what point, do we need to, do the testing? And who's at risk? Is it primarily kids with underlying issues? Once again, as I stated before, most kids do not have underlying issues. Most kids don't show signs of illness previous to developing the symptoms consistent with PIMS. We have to, figure out what are the constellation of symptoms, because it doesn't fit Kawasaki's perfectly. It looks very similar to Kawasaki's. It can look similar to toxic shock syndrome, but oftentimes it does not fit, that constellation of symptoms perfectly. So as we learn more by collecting data and doing research, I think we'll figure out that this is its own inflammatory process, separate to Kawasaki, separate to toxic shock, and hopefully we'll be able to figure out who's at risk and how wide this will be spread. It is, it's something that we've seen in April in Europe, and then we start seeing cases in New York. Now we're starting to see cases in Kentucky, cases in Oregon. So it is starting to spread, but we're getting better at diagnosing it too. We're getting better at figuring out what the symptoms are, and the CDC will be, putting out a report later on this afternoon, this evening, to try to give us, some information so we can diagnose this effectively and quickly.
Yeah, we'll be looking for that guidance that will be, again, distributed to doctors, and I'm sure the CDC, this is ever evolving, so I'm sure there'll be more and more information out as the days move along here. What advice do you have for parents with children who are sick, especially during this time of coronavirus?
Don't be afraid to talk to your pediatrician. Don't be afraid to bring your children in to be seen. We have to have that ongoing communication with the symptoms and how your child is feeling, and we need to improve that communication and continuity of care. So with any symptoms, especially fever that goes on for more than 3 days, serious or significant signs or symptoms of illness, don't be afraid to talk to your doctors and get your child seen. They need to be seen.
Beacon's open safe, ready to see and treat
Absolutely.
children. Yeah.
Absolutely.
Thank you very much, Dr. Kinney. Appreciate your time today.
Thank you.